Hello everyone. Today is November the 25th. I'm Dr. Adam London, Director of the Kent County Health Department. COVID-19 seems to be getting closer to us every day. As our numbers continue to rise, more and more of us are learning of someone we know who has had COVID-19. Every day we are hearing more and more of these stories. In the past week, local and national media told us the story of Dr. David Burkhardt, an emergency medicine resident at Spectrum Health here in Grand Rapids. At 28 years old, this marathon runner was admitted to the hospital where he works because he could not take more than 10 steps without losing his breath. Thankfully, his treatment went well.
I worked 24-hour shifts in the hospital where I wear a mask for 24 hours straight. They're annoying, but if wearing that mask can save one life, it's worth it.
Tragically this week, we also learned of the death of COVID's youngest victim in Kent County, 14-year-old Hodges. You may remember Hodges from 2017 when Grand Rapids police handcuffed her and put her in the back of a cruiser. The outrage over the incident prompted change in the way the Grand Rapids Police Department now treats interactions with children. It's called the honesty policy. Honesty Hodges passed away on Sunday. In her short life, Hodges leaves a meaningful legacy. Sadly, that legacy now includes being the first child to die of COVID-19 here in Kent County. From local news reporting this week, we learned about Bowman, an 18-year-old Rockford High School senior. A healthy and active football player, he first got the virus in October. But a month after his mild symptoms had subsided and Bowman had returned to school, a fever forced his parents to bring him to the emergency room at Helen DeVos Children's Hospital.
It's just he was joking in the emergency room, even with that temperature, and then within a few hours he was unable to do almost anything.
Bowman was diagnosed with multisystem inflammatory syndrome, a serious condition associated with COVID-19, where the heart, lungs, kidneys, and other organs can become inflamed. Every day the CDC is learning more about this rare condition and its association with young people who have had COVID-19. After 5 days in the hospital, Bowman is now recovering.
I felt like I was freezing and burning at the same time and I couldn't breathe. I just kept pushing through and I said, I'm going to see tomorrow. Tomorrow's a new day.
Many people are sadly coming to the reality that COVID-19 is a real danger. And it's even sadder that much of this could have been prevented. With infectious disease, it's not enough that individuals protect themselves. Everyone has to protect each other if this is going to work. Yes, I believe that many of the illnesses and most of the orders closing businesses could have been completely avoided if everyone could have simply followed the simple precautions that we've been talking about all year. But I do have good news. It's not too late to make a difference and to be a hero. Your actions right now can still make it hard for this virus to spread. We need your help to save lives and livelihoods. And yes, vaccine is on the way very soon. Every day we are closer to the end of this pandemic. Your actions right now will be our legacy. I want the story we tell our grandkids to be one about how we all came together in 2020 and we beat this invader. To do that, we've got to find a way to drop our differences for at least a few months. And so I encourage you, please stay positive, stay heroic, and stay healthy. I'm Dr. Adam London from the Kent County Health Department, and I'll talk to you again very soon.